Well, Dr. Ashton here, taking a look at some of your medical questions. Here's one from L. Says, how do I get doctors to not rush through the visits? I need a proper, respectful way to address this.
L, I'm so glad L sent in this question. I want to explain some kind of behind the scenes why this happens. By the way, no doctor likes spending 4 minutes with a patient. It's stressful. We're not covering everything. The reason that unfortunately happens has to do with a lot of issues with our healthcare system. Doctors who take insurance, unfortunately, they don't get reimbursed based on outcomes. They get reimbursed based on volume, and that's true a lot of times, even if a doctor is working for a hospital. So seeing one patient in 4 minutes will generate more reimbursement than seeing one patient in 40 minutes. This is part of the reason a lot of doctors don't participate with insurance. I would rather open a restaurant than spend 4 minutes with a patient. It's not the way we are trained. It's not what we want to do. The answer to Elle's question, if you're in that situation, which a lot of patients are, say to the physician, I understand you're tight on time. I have some more questions. Can I email them to you? I bring them written down, or bring someone else, so that, a lot of things don't fall through the cracks. But this is a major, major problem. Patients are suffering, and healthcare providers are suffering because they don't like to practice medical care like this.
That's too bad to hear it like that. I know good folks and good doctors, but you got to get them in and out just to keep your lights on.
That's right.
A lot of times.
Literally.
All right, Dr. Ashton, thank you for that. And also your prescription for wellness today focused on men's health.
It is in honor of you, my friend.
Right.
So some tips for men in anyone's lives. These are kind of my big three things to keep an eye on. Number one, if you are sleeping near or next to a man who is snoring loudly, do not ignore that. That could be a sign of obstructive sleep apnea, which can have major effects on the brain and the heart. Don't ignore erectile dysfunction. This is now well known in medicine to be kind of a surrogate warning sign for vascular disease. Can be, so don't ignore that. And don't ignore mental health issues. We need a checkup from the neck up, and men are included in that as well. So those are my big three.
I have learned a lot about that last one. Mental health has been a big focus over the past couple of years, trying to get rid of the stigma and the taboo
that's
there.
true.
All right, keep your questions coming to Dr. Ashton on our Instagram at Dr. J. Ashton.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.